In just a few short minutes, we'll dive into the details of healthcare claims, examining why denials occur, and more importantly, how your staff can prevent and manage them effectively. Whether you're part of a small practice or a large healthcare institution, these strategies will help streamline your processes and improve your claim approval rates. We'll explore current trends and statistics, practical strategies for reducing denials from the get-go, and tips for dealing with denials when they do occur. And now that you know what we're going to cover here, be sure to check out the description below this video where you'll find helpful links and more that'll further your understanding. And with that said, let's jump into it. Let's start with a few recent statistics on claims denials because a recent report has some interesting denial data for the healthcare industry. The average denial rate was almost 12% in 2022, an increase from 10% just a couple years earlier. And when looking at regions, the highest denial rate was in the Pacific states with a whopping 17%, followed by the Southern Plains states at just over 12%. Front-end revenue cycle issues account for 41% of denial reasons. And although this is a decline from 46% in 2019, it's still the most common reason for denied claims. The most frequent reasons for denied claims are related to registration or eligibility, missing or invalid claims data, requests for medical documentation, and authorization or pre-certification issues. So is there some low-hanging fruit that can prevent denials? One estimate of avoidable denials is 82%. So let's focus on claims denial management strategies that you can use before submitting claims. And let's start with registration staff. It's important to ensure that your registration and eligibility screening processes are working properly. Get a sense of the reasons for denied claims for lack of correct insurance coverage or other health plan coverage. Do a root cause analysis if necessary. Ask questions like, are registration staff capturing demographic and insurance coverage before or during the initial visit? Are they using the capabilities of the revenue cycle management or electronic health record systems as extensively as possible? Most modern systems will have a reporting capability that can be utilized as part of your denial management process. And many systems have automated eligibility inquiry capabilities that can reduce denials from unrecognized lack of eligibility. Then there's the claims submission. Here you want to strive to get claims accepted the first time they've been submitted. This means ensuring that there is no missing or invalid information. Again, analyze why claim denials occur in this area. And ensure your staff is using every feature of your medical billing software to send clean claims to the claims clearinghouse. Next up are advanced beneficiary notices, or ABNs. Deal with claims for non-covered services up front. Medicare and other payers have frequency limitations on some types of services, so make sure the staff is completing an ABN with patients before the service is rendered. That way, even if the claim is denied, you can bill the patient for the service. Prior authorization, with the key word here being prior. If you need prior authorization for services, make sure it's requested and in hand before the service. Medical necessity. This is another issue that can and should be dealt with before providing a service. Payers like Medicare have local and national determinations of medical necessity for a wide range of services. Every specialty physician practice should be successfully identifying the medical necessity for the services they provide. And lastly, medical coding. You want to avoid medical coding errors. Modern electronic health record systems can assist with automated tools to achieve accurate coding for services and diagnosis. Of course, these types of coding systems are only as good as the underlying documentation entered by the provider, but they can be an improvement over manual processes. And now for the harder to reach fruit. If you're having claims denied, now what? Well, you're stuck having to make your way through the claims appeals process. All payers will send an explanation of payment or remittance advice. Find the claim adjustment reason codes on this documentation to see why the health insurance company denied the claim. This code will point you to the reason for the claim denial and set you on the right path for appealing the denial. Is the insurance company asking for medical records? Are they questioning the patient's eligibility or the medical necessity of the denied claims? Depending on the state, Most insurance companies are required to respond to the appeals of denied claims, some including timeframes for a response. And don't just resubmit the claim. Most insurance companies use automated systems for claims processing. When a resubmitted claim is reprocessed, it will likely simply be denied again with the same claim adjustment reason codes. Keep track of the reason codes and use them to avoid future claim denials. There are at least 3 reasons for an unrecoverable claim denial. The first is lack of patient eligibility or covered benefits. Payers are very sensitive to issues of eligibility and covered benefits. While many insurance companies base their marketing on providing health care, they really are only financing a defined set of healthcare benefits to their enrolled populations. The next is lack of provider eligibility. It's not uncommon that healthcare providers in a group practice setting are not all credentialed with all health insurers offering coverage in a geographic area. Make sure patients are seen by the credentialed providers in the group. And the last, untimely filing. All denied claims hurt, but this one is among the most avoidable. Other reasons for claim denials may be somewhat inscrutable, but claim submission timely filing limits are pretty straightforward. Don't let this be a reason for missing out on getting your claims reimbursed. We've covered a lot, and quickly. From the staggering statistics of claim denials to actionable strategies that can drastically reduce and efficiently manage these denials. I hope you have a clearer understanding of how to tackle both the low-hanging fruit and the more complex challenges in claims management. Implementing these strategies will not only improve your financial performance, but also allow your staff to focus more on patient care rather than paperwork. Remember, the key to managing denials is not just reacting to them, but proactively preventing them. We encourage you to reach out with any questions or for further consultation on enhancing your claims processes. Remember to check out the description below this video for helpful links and more. In the meantime, give us a call, drop us an email, or come visit us on the web. And don't forget to subscribe to our channel to keep up to date on the business of healthcare. The Fox Group, serving the healthcare community since 1989.